Audio Jungle.
Experts say cardiovascular disease is responsible for 11% of all non-communicable conditions, accounting for 29% of all deaths in Nigeria, and a global estimate of 17.9 million yearly. The Coordinating Minister of Health and Social Welfare, Professor Muhammad Pate, disclosed this on Friday in Abuja during a ministerial press briefing on World Heart Day. He said, out of these cardiovascular deaths, 85% of them are due to heart attack and stroke, as over 3/4 occur in low and middle-income countries.
I want you to adopt a healthy lifestyle, always to take your heart age longer and healthier.
The World Heart Day 2023 on its theme, Use Heart, No Heart, is celebrated every 29th of September, reminding the public of the vital functions in the body, as every average heart rate is 60 to 100 beats per minute. With each heartbeat, the heart pumps 70 millimeters of blood out of the heart, which is equivalent to 5 to 7 liters of blood per minute.
Emergency response box is just simply an emergency cardiac emergency aid box that contains the following. This is an ammo bag, and this is the blood pressure monitor, and this is what is called AED, the automated electric defibrillator. This is used in cases when patients have heart attack, which usually is due to arrhythmias. The defibrillator saves life. It stops the arrhythmia and brings the heart back to life. So I thank you for this huge gesture in saving the lives of our citizens. So join me on the behalf of Federal Minister of Health and Dr. Akiroye. I love the cardiac emergency bus. Thank you.
The launch of the Cardiac Emergency Reference Bus enables humans to protect the heart against diseases and conditions that will cause its malfunction. At the event, Professor Muhammad Pate, represented by the Minister of State, Dr. Tunji Alausa, said there are rising cases of morbidity and mortality caused by cardiovascular disease, often underestimated and lack of awareness, and urged all to take responsibility to eradicate the sudden death of adults and children.
Morbidity and mortality due to cardiovascular diseases in Nigeria is underestimated because of inadequate awareness and health-seeking behaviors, as well as limited screening, diagnostic, and therapeutic services, including poor data repository. Given the silent and chronic nature of majority of the cardiovascular diseases, it is important to institute long-lasting measures to prevent, detect, manage them early in order to avert complications such as heart attack, heart failure, stroke, and even death. Luckily, the risk factors for heart diseases are well known and likely preventable. For example, hypertension, diabetes mellitus, lipid abnormalities, overweight, obesity, tobacco use, alcohol intake, and insufficient physical activity are significant modifiable and preventable risk factors for heart disease and other non-communicable diseases. The majority of heart diseases are preventable. Engage in enough physical activity, at least 30 minutes daily. Number 2, avoid tobacco use and exposure to second-hand smoking. Number 3, avoid harmful intake of alcohol. Abstinence is the best. Number 5, eat healthy diet containing a minimum of 3 to 5 servings of variety of fresh fruits and vegetables spread over each day. In addition, eat variety of whole grains, lean meat, fish, beans, and lentils. Limit processed foods. Limit salt intake to less than 5 grams, which equates to about 1 teaspoon a day. reduce dietary cholesterol, and avoid industrially produced trans fats. Know your numbers by regularly checking your blood pressure, cholesterol, and blood glucose level.
The ministry further enjoined the public and civil servants to take advantage of this year's World Heart Day and get screened for hypertension and counseling in and around the Federal Secretariat Complex Phase 1 and Phase 3 and the Nnamdi Azikiwe Airport. Vincent Okushi, reporting for Quality Television.
Audio Jungle.